I'm Lauren Grabansky, and I'm a registered nurse, and I work in Main OR PACU, and I'm going to take you through an epidural setup today. And first things first, we use the Alaris pump, which is what we will run our continuous medications through, such as Dilaudid and bupivacaine. And then here is the tubing that we will use for those continuous medications. And you want to make sure that it has the yellow lining through it, because that signifies that we're running an epidural. Our next set of equipment is our PCA pump, and we're actually running, it's a PCEA because it'll be going through the epidural, but we utilize the same pump as a normal PCA. We also have the tubing for the PCEA, and it's, again, we use the yellow tubing since we're setting up an epidural. We next have our Y-type extensions, which will bring all three medications together for a single entry point into the epidural. And we will normally utilize 2 extensions per epidural. We then have our yellow epidural tubing stickers, which is what we will actually wrap around the tubing to signify an epidural is in use. We then have our pink epidural stickers, which is something that we'll utilize to place on each pump to signify that we're also using an epidural. So then we will start priming our tubing. So I'll prime the fentanyl first, and what you do is you'll prime it through the tubing and only to the point of the Y. So you'll stop right here because you don't want it to go through the rest of the tubing. So after you're done priming the fentanyl, you'll want to clamp that tubing to make sure that there's no backflow when you're priming the other tubes. So you want to make sure that you clamp the fentanyl. Next, we'll move on to priming our continuous medications, which are bupivacaine and our Dilaudid. And it doesn't matter if they're interchanged as long as they're on a continuous Alaris pump and on the left side of the brain of the IV setup. So then I like to prime the Dilaudid. So we'll move up here and we'll open up the Dilaudid and make sure that we prime it to the very tip of the Y. So just right where it V's down. We'll prime it only to that point. And then we'll make sure it's clamped after we prime it. Finally, we'll set up the bupivacaine infusion, and we'll prime that through the entire tubing set, making sure the fentanyl and the Dilaudid are clamped. We'll open up the other two to make sure that we prime it throughout the line. So we'll prime it all the way down and through the entire portion of the epidural to the point of where we would insert for the patient. And that way that can clear out any Dilaudid or fentanyl that might be over primed into this main line. So after you've primed your tubing, we'll set up our pump. So first things first, you want to make sure that the pump is set up to new patient. You click yes. And you want to make sure that you choose the epidural setup so you get the medications for the epidural. So you'll click no, scroll down, and they have an epidural section for the medication library. And you'll click this, confirm, and then that way you have all of your pumps available that you can then set up for your medications. So we'll plug the tubing into the pumps. So first we'll start with our bupivacaine. And you'll just make sure you trace the line down so you're putting the right medication in the right pump for when you program. And you'll just plug it in like your normal IV pump. And same thing for the Dilaudid. You'll just make sure you trace the line down. And then again, plug it in like you would a normal IV. And we like to trace our lines to make sure that when you program the pump that you're programming it appropriately. And last but not least, we'll plug in our fentanyl PCEA. And again, this is just like a setup for a normal PCA. So you'll get your key, open up the PCA, and just set it up where you insert it in this little ridge. Bring down the first clamp, and then the second clamp that crosses over and puts it in its little seat belt. And then you'll close and lock your pump. And then finally, you'll want to label your tubing. So first things first, we'll label the pink stickers on the pump itself. And I like to put them on each pump, because there's no mistaking then what you have in front of you. But you want to make sure you're not covering any of the screens that are going to tell you your rate, because you want to make sure that you're able to visualize the screen still for safety. And then what you'll do is you'll label the tubing itself. And again, I like to label each tubing. So we'll do the bupivacaine, then the Dilaudid, and then finally we'll label the fentanyl over here. And actually, not finally, you want to do one last connection for your sticker, and that's the one that leads directly to the patient. So right at the entry point where you would insert to the patient, you want to make sure that you put, that you put a sticker. So there's no confusing that this is an epidural, and we know exactly which lines are epidural. So after you've programmed your pump, you want to make sure that, again, you trace your lines so you know that you program the pump accordingly, and just double check the order. Then you'll want to go over to your patient, and you want to make sure before you connect any tubing to the patient that you assess the insertion site to the patient to make sure there's no bleeding, any oozing, any possible leaking medications. You want to make sure it's just a nice clean site. And then what you'll do is you will tape the epidural tubing as such. And just create that little loop in the tubing itself. And this way we can make sure that nothing gets tugged, it's nice and secure. Then what you'll want to do is you'll take a 3cc syringe and you want to make sure that you keep everything clean. So you don't, if you remove a cap, you want to make sure you insert the 3C syringe right away to avoid contamination. So you'll take off the cap, insert a 3C syringe, and pull back to ensure that there's no liquid in the line. If there's liquid in the line, that's a sign that the epidural could be in the incorrect place. So then you'd want to notify the doctor as soon as possible. So when you draw back, it should just look like air. There shouldn't be any liquid in the tube, except sometimes you might have just a little bit, so less than half a cc. And that is okay because that might just be some residual medication that's still in the line. So once you've checked your epidural, you'll disconnect the 3C syringe, and then you'll connect your epidural tubing. Again, making sure when you remove caps that you're not letting it fall to the ground or touch any part of the patient. So then you're connected.